Are you getting sick or just getting older? We all experience a variety of symptoms as we age, but at what point should we seek help from a doctor? Tyson Romero talked with an expert to hear the signs and symptoms of some common but serious health conditions.
Time is something we're all trying to fight, but we're all getting older. And with that comes the different symptoms we feel as we age. Though, how can we tell if it's just aging or if we should actually see a doctor? So helping us with that question in today's sponsored segment is Dr. Rhonda Randall. She's the Chief Medical Officer at United Healthcare Retiree Solutions. Dr. Randall, thank you for being with us.
Thank you for having us, Tyson.
Absolutely, absolutely. So today you're going to focus on some of the conditions that both old and young adults may experience. Why is that?
Well, I hope to provide some information that helps both your younger listeners and your older listeners discern between what's normal aging and things that might be concerning that there's a greater condition brewing. Normal aging, for example, over the age of 40, everyone recognizes that you're starting to need to hold the paper further away, or maybe that you need reading glasses, or that your joints ache after you've done some activity out in the yard. Arthritis is a normal part of aging, but there are many conditions that have warning signs that are not a normal part of aging, and we want to catch them early.
Absolutely, absolutely. So let's start first. Diabetes. That's one that both old and young adults can experience. Tell us more about the signs and symptoms that we should look out for.
Well, a particularly important condition because it's become an epidemic in the United States. In fact, the CDC estimates that 100 million Americans have either prediabetes or diabetes. Some warning signs could be that you're carrying excess weight. Being overweight is a significant risk factor for diabetes, but other warning signs might be frequent thirst, excessive urination, dry skin. The skin is often a good indicator that there's something else going on with our bodies. That you feel numbness and tingling in your hands and feet, for example, or blurry vision. Those all could be warning signs that it's time to get your blood sugar checked.
Those are some very interesting symptoms, especially the skin, taking a look at the skin to see if you have diabetes. Let's move on to something like osteoporosis.
Right, osteoporosis, or brittle bones softening as the bones, is not a normal part of aging. It happens to both women and men, but disproportionately to women, and often there's no signs or symptoms whatsoever. So it's important to get a bone density scan from your doctor. Warning signs that you might be at higher risk for osteoporosis would be that you're not getting enough weight-bearing activity, like taking a walk every day, or that you are somebody who hasn't had a lot of calcium and vitamin D in your diet.
Okay, those are some very good things to look out for. Now, one last thing. Let's cover dementia and Alzheimer's, because that may be something that maybe more older adults might feel, but it's something that we should always be looking out for. Tell us some of the symptoms there.
Well, we really care about our brain health as we age, and it's something that's becoming more and more recognized in our nation, that we need to keep our brain active as we get older. So learning new things, doing games and puzzles, for example. But we also know there's an important linkage between brain health and heart health. So those same things that you're doing to keep your heart healthy might help you ward off things like dementia and Alzheimer's disease. Other things that might be a good indicator that there's a risk of having dementia or Alzheimer's disease is not the normal everyday I forgot my keys, but more of a global memory loss, having difficulty doing your normal activities of daily living, taking longer to do those common things, or having changes in your mood. Really important to get your information from reputable sources. One of the ones that I'll encourage you to go to is newsroom.uhc.com. There's a variety of health and wellness information on our website.
Fantastic. And we'll also have links to that on our website at goodforutah.com. That was Dr. Rhonda Randall with United Healthcare Retiree Solutions. Doctor, thank you so much.
Thank you, Tyson.